PHS stands for Piedmont Health Services, and it's a group of federally qualified health centers that are primarily located in areas that are underprivileged or under-resourced. I would say PHS has been a good fit for me because I'm passionate about tackling health disparities, and the patient population that I get to work with is perfect because we are in an area that is under-resourced.
We have 10 sites. They're all at areas that are medically underserved. We serve as a safety net for the community, especially the folks that don't have the ability to afford healthcare insurance.
PHS has been working with rural and underserved communities for a long time, more than 45 years. Our communities had mistrust of the health system, and we've been able to build our trust, build those relationships, and continue to work together. What PHS is doing to keep Black and brown doctors is we do it through residencies. We continue to follow them during their career to make sure they're achieving their goals.
I was at PHS during my residency, which was 3 years, and then I stayed on after that. So I've been here for a total of about 4.5 years now. What brought me into family medicine and medicine in general is wanting to be able to serve an underserved patient population. I feel like working at FQHC like PHS has really allowed me to be able to do that. I'm able to take care of a lot of minority patients, which was important to me, and also a lot of Spanish-speaking patients.
My favorite part about being a physician at PHS is being able to have a breadth of experience. So as a family physician, I'm learning how to take care of babies, take care of elderly patients. So having that breadth to do everything is some of the best parts.
My parents were, they came in, immigrated from Mexico. They didn't have any health insurance. They were farm workers. Me and my brothers grew up, our primary care physicians were FQHCs, so it's very passionate for me to give back. It's almost like a full circle to work at a FQHC.
It feels really rewarding. There are times where patients are like, oh, I wish we could take a picture. You're the first Black doctor I've had, or, oh girl, I've never been treated by a Black doctor before, so that's really rewarding.
The reason why I went into the FQHC track versus the university track at UNC Family Medicine is because, again, I wanted to give back to those communities, underserved communities, and I knew the FQHC track will give me the tools that I need to serve underserved communities.
So I chose the UNC Family Medicine Federally Qualified Health Center track because I've always wanted to open my own community health center, so I figured this would be the perfect chance to work with the patient population that I do want to help in the future, but also to learn the logistics behind running a health center.
Since I moved to the United States about 14, 15 years ago, at the beginning I did not have a full provider to take care of my health. So I think it's very important that we reflect the community that we serve. Health is not just our symptoms, it's also about how we see the world, how we feel. And I think when our providers and our community reflect what our patients, the community we serve, I think our health can improve.
I would definitely recommend for family medicine residents or family medicine doctors that are interested in the program, they should definitely look at PHS. It's from cradle to grave is what they call family medicine. We're delivering babies, taking care of prenatal patients, but also caring for the elderly in hospice care.
I would recommend PHS because for the provider it would be very rewarding. They're going to get to work with an amazing group of patients, and then vice versa. I believe the patients will get paired to a provider who truly cares about their health and is going to provide a foundation and also allow teamwork. And it's not just going to be like the provider telling a patient what to do, but they'll be able to work with their provider as a team.
Piedmont Health is what family medicine should be. What brought me into family medicine and medicine in general is that I wanted to be able to take care of any demographic of patient and not have to turn them away because of their age, their gender, or their ability to afford to see me. And I feel like that's what family medicine should be in terms of providing good quality care to anyone who walks through the door.